Okay, we're recording now. We're live. All right. Hi,
Hi.
Emmy.
Hi,
Nice
Adam.
nice to be in touch with you. And I want to first start by thanking you for the time today. And also, obviously, you are a medical worker. So, on behalf of all of my followers, myself, my audience, and America, thank you so much for all the work and effort that you're putting in right now to help in the country.
Yes. Thank
So,
you for having me.
of course,
And yeah, and everyone's working really hard. All the nurses, all the doctors, and everyone in the hospital, including, the environmentalists, the security, everybody, even patient transportations. Everyone's working really hard.
that's awesome. That's great to hear. And before we continue, I did want to say that this podcast, vlog, whatever you want to call it, interview, is sponsored by Dear Asian Americans Podcast. You can check them out on Instagram. We'll put a link up here. You can check them out on Apple, Spotify. And basically, it's a podcast series posted by my friend Jerry Wan. And what he does is he interviews people about the Asian American experience. So if you guys want to hear more content around that, you could definitely check out the Dear Asian Americans experience. So I got a few questions I want to ask you about the coronavirus and your situation with it, and then we'll move on to some of the user submitted questions. So where are you currently working right now?
I'm currently working at New York Presbyterian Methodist Hospital in Brooklyn, New York.
Very cool. And how are you doing in terms of PPE, right? Personal protective equipment, is that right?
Yeah, that's exactly right. So, as a whole country, I just want to say we might have enough for the whole country for now, but it's always a problem in the long term. Right now, we're not using PPE properly, and that's the problem. And that's our biggest worry as the front line, to be in the front line. Just because, from the beginning, like you see the news and you see what China's doing, you see what Italy's doing, they have these hazard suits on. They're all covered 100% from head to toe. While we right now are using yellow gowns, we got goggles, we have face shields that are given to us from other companies, and we have N95 masks. That's probably what's the most important, and regular surgical masks. So from what they're telling us in my hospital is that we have to use this N95 mask, one per shift. Now, the problem is that as per CDC, these N95 are only good for 8 hours. So our one shift is 12 hours. That means we need at least two to be really protected, because we have to constantly go in and out into the patient's room for our whole shift. And as far as just wearing our yellow gown, my biggest concern is that our necks are exposed, and we just don't have that overall feel of protection.
Right.
We are changing our clothes at the end of shift, just to protect ourselves, and we are wearing, things to cover our hair and booties just to protect ourselves. But everything is just kind of like, you have to take your own precautions, which is just as scary because management sometimes is not on our side.
Right.
This is only speaking for my hospital in Methodist. There are a lot of other hospitals that are probably suffering more than us. I've heard stories where people are reusing their N95 for a whole week. Now that's just really not applicable. Filters only have a certain amount of time.
So you're saying after 8 hours, if you're wearing an N95 mask, it's basically rendered useless. It's almost like not wearing one at that point.
Basically.
Wow, I didn't know that. That's interesting to hear. I don't think a lot of us know about that.
Basically.
Wow. When you were at work, are you nervous the whole time about contracting the virus? Like, how are you emotionally dealing with that?
So I have to be honest, I actually haven't gone back to work with a patient with a positive COVID. Last time I was at work, it was last week, and I worked with patients who are COVID negative. So from that time, what I remember is that there's already a lot of movements, and there's already a lot of scare, and it's definitely very hectic. I think at the time we had only 60 something positive cases. My ICU, I work in the ICU, so it's intensive care unit. My ICU is already full with these positive cases. So we have 10 isolation beds, and all of them are positive. And then at the time, we were thinking about ways where we're going to have the rest of these patients if they do come. So they need to open up other units. When I worked in my unit that night, there was a lot of movement, such as patients from the isolation rooms were coming onto my side. So we have two sides. One is called COVID City, and the other one is basically clear and negative because it's non-isolation rooms. These rooms are just open. So what they did was they brought the patients who are negative to my side because I have open beds so that they can take patients from the ED who are positive and need the isolation rooms, meaning that they need to be ruled out of COVID first because we're taking precautions, so we're putting them in the isolation rooms.
Right.
With that in mind, already a lot of movement, and we're doing the movement and nurses, we're doing everything. There's a lot of fear from what I already saw from, people who are cleaning the rooms to nurses ourselves, to physicians, to security, when they round and everything. Just because, for example, the environmental people are like, what's the protocol? How should we be cleaning this room? So everybody had a lot of questions. So we turned over to management. But management is just telling us that, these things are always changing, and we don't have an answer for it now, and we're figuring it out as we go.
Wow, that's pretty scary that no one really has firm answers kind of surrounding this. Do you know anybody from your job that has personally contracted the virus yet, or have they been lucky and they haven't?
Yes.
You have friends
Actually,
wow.
Yeah. As of today, I found out that I know at least the one person that has it, and she works with me in ICU. Fortunately, she's doing better. She's gotten her medications. She told me about her symptoms actually, and we have a pharmacy that I reach out to, just because I'm a nurse practitioner and I know my abilities of writing prescriptions. So she was started on antibiotics and being quarantined at home for a week off. I believe she's feeling a lot better now. But as of today, we found out that she was positive.
What antibiotic is she on? Is it Z-Pak or something?
D-Pak.
That's right. Okay, cool. I know a little bit about this world. Just a very little bit. Awesome. No, this is really good insights, and I'm happy that you're healthy as of now, right?
I'm good as of right now.
Okay, cool.
Yeah, thank God.
Awesome. So I'm going to ask some questions that my viewers submitted to you. People definitely are very curious about this topic because I think there's a lot of unknowns and uncertainties kind of swirling around right now. So I think this is going to help some people out here. So this question comes from my friend Melissa.
Mm-hmm.
I'm curious about two things. So we'll do a two-tiered question. Question one, if you believe to have a mild case and are staying home and combating it, when do you know it's safe for you to leave? Like, when is it out of your system? So when is it out of your system? When do you know that you can leave if you've contracted it?
So I think in general, on average, people are taking 2 weeks at least out of their life to just get better, and just because you got to take care of yourself first. Why do I say 2 weeks? Just because I think what you really need could be 1 week, because you have 1 week, for example, of like medication that you can get, and then just another week of taking precautions. I mean, will this virus completely leave? I think you're healthy enough, you'll be able to fight it off because we have our own immunity. However, the possibilities of you getting it again is also very possible, just because right now I think there's 8 strands of this COVID-19. So it's like the flu. The flu had 4. So it's like that's why we get flu shots every year, just because like we don't know which strand it is for this year. For those COVID-19 virus, there's 8 different strands. And if you fought off one, you don't know if you'll contract another one. But it's safe to say that I think 2 weeks is a good time period for you to get better from one, and then of course continue taking the necessary precautions in the future.
Cool.
For the time being.
And then the other question, which I guess you kind of answered this, if somebody gets it once, can you get it again?
Yeah, it's a question that I've heard before, where what happens if it happens again? Like it could happen. Like I said, I compared it to the flu, just because it's a virus. Now it's not exactly like the flu. I mean, in my opinion, it's definitely deadlier than the flu, only because it lives on surfaces longer, and there's no vaccine right now. It lives on surfaces for 2 weeks, while the flu lives on surfaces for about 3 days. So now if it's on a surface for today you can contract it by touching, and you don't even know for the next 2 weeks.
That's so scary.
Yeah. And it can be anywhere.
Wow. This question comes from my friend Katie. Are there any home items that you can use as mask filters? I guess this is for someone who lives at home or staying at home right now and can't find official filters. What can they use if they're at home?
Yeah, finding filters right now is definitely difficult. I mean, I even like try to look for myself, just because like, when I go back to work, am I gonna get enough of it? I'm not sure, So I looked, and they're being produced in China, and I think they're very backed up, and they're not able to deliver until next month.
Wow.
And two, there's just a shortage in the whole nation, or they're just gonna be very expensive. Um, there's been a lot of jokes on saying use a bandana or use like just something to cover your face. I mean, do I think that will really protect you from this enemy that you can't see? I don't think it will really protect you. It might make you feel like you're safe, but I mean, we are wearing N95 masks, so I would take every precaution necessary.
All right. This next question comes from my friend Sam. She has a friend who's pregnant that tested positive for coronavirus. Is there anything that you know about pregnant women with the virus?
Hi, Sam. So, yeah, it's very scary for the whole world. Thinking about even going to the hospital. I think up until the point you have to deliver, that's the point. It's like, oh shit, I have to go into the hospital where you don't know if you'll get it or be contracted with it. It's changing the care for moms at this point because they're limiting visitors for everybody.
Right.
So to be a mom right now and to have to know that, oh my gosh, you don't know when you're gonna deliver is scary because I'm not even sure if you can have any visitor. Dad might not even be able to be there.
Oh, that's crazy.
They're really, really restricting it. And for a mom, they are not able to get that emotional support, and there's always that possibility, like you don't know what's going to happen. So there's definitely a lot of fear. I've heard stories where the mom didn't even know she was positive, and she went into the hospital and she gave birth. The baby came out healthy. But I think one of the stories, the mom had to like go to ICU, and she, the same treatment, intubation and all that had to be done for her. And is there a possible transmission between mothers and babies? We don't even know. We don't have enough evidence yet.
Wow.
So.
That's crazy. So what happens if a woman's already pregnant and already has tested positive for coronavirus? So she's confirmed to have it.
She's confirmed to have it. I think her immunity is already low to begin with. And the fact that she has to protect her baby is a lot on her body. So I think first and foremost, nutrition. You should be taking your prenatals. I think the first thing you should do is, if you have any of these symptoms, you should call up your doctor, and of course ask them what you should do first. But to protect your own immunity, take your vitamins, make sure that you again hydrate, and you treat the symptoms based on what the doctors tell you. I think Tylenol is safe to take during your pregnancy.
Okay, cool. Next question comes from my friend Chris. He wants to know, why are some young people getting sick when others aren't?
Yeah, hi Chris. That's a good question. So, I've wondered that myself. And it's actually really scary to see that from my friend told me. I'm going to go back to saying her name, Julie Shea, who works at Mount Sinai Hospital. She told me that she's been looking at x-rays, and x-rays for people who are 30-year-olds compared to who are 80 years old look the same. Even though there's a huge timeline between them, their x-rays end up looking the same. Why is that? It's just the reality of this COVID illness. And why are younger people getting it? First, it could be a lack of knowledge, a lack of unawareness, or just not thinking that it would be a big deal. That could be one part. I'm not saying that everybody's like that, but two, it could be because they already had an underlying issue. It doesn't have to be, first of all, chronic issues are already there. if you have diabetes, you have hypertension, if you have any other lung issues, you're already, I'm sorry, not so much hypertension.
Because I have hypertension.
I'm sorry, let me go back to my notes. Cardiovascular disorders,
Okay.
diabetes, respiratory issues, and cancer. These are the 4 huge topics that CDC, I think, hit. So with those already in mind, of course, there are other like chronic, like developmental issues. If people, if they're not able to take care of themselves,
right,
you know, they need an aide or they need a companion. Those also fall into younger populations, and of course, those people who smoke and vape. A lot of these younger children, kids, students are exposed to this. It doesn't have to be like, you know, I'm like, it's secondhand smoking. We know all about it.
right.
That can unfortunately put them at a higher risk too.
Yeah, that's kind of what I thought. I felt like if you're younger, because what I saw on CNN, and this is what I've thought myself, is even the U.S. isn't giving a lot of information about who's getting sick. For some reason, especially with the younger population, they're not publishing that data. And to me, I think it's important to know, like, all right, if we look at the people that are under 30 and the ones that are hospitalized and requiring ICU treatment, well, what are some of the similarities in their lifestyle? Are they vapors? Are they smokers? Are they drinkers? Do they not exercise? Are they overweight? These are factors where I'm like, we should know that. And I feel like when the news doesn't report these facts or doesn't report the details, I feel like it's perpetuating fear. It almost makes it seem like nobody's safe from this virus. Now, maybe that is the case. Maybe nobody is safe from the virus. But I thought that if you're young and healthy, like a teenage kid, you're less likely to end up hospitalized or in the ICU. And I just feel like it has to do with factors such as how healthy of a lifestyle you're also living, which they're not really talking about, which I'd like to see more information about, you know?
Yeah, there's definitely still a lack of knowledge. From what we know, it's definitely the older populations that are more vulnerable. And like I said, of those people who get it, 80% of it is mild symptoms, but that doesn't mean that you won't get it. It's just a milder case of it because you have the immunity to fight it.
And it'll resolve on its own.
Right, yeah. And there's a lot more individual stories that we have yet to hear about. And I feel like, you know, once I get back into work and like I hear a little bit more about it from other people too, I think I'm able to get a better understanding. One example, though, I do have to say is there was a patient that was 30 something years old that my coworker told me about. She had Down syndrome. So with that in mind, Down syndrome is a chronic, like I said, not immunity wise, but you know, more of like, you know, they need somebody to take care of them, or they're not really educated, they're not able to retain the information on what's going on. So there might not be as much precautions taken, things like that. You know, that's one case, and she was she is, I'm sorry, 30 something years old, you know, in our ICU right now.
Right.
So that's one example.
Crazy.
Yeah, it's
Awesome.
definitely a crazy time. And I just want to say, you know, all of these examples or stories are from what I hear or from my personal opinion. I definitely do not have enough knowledge to educate you guys on everything about COVID. But I'm just sharing like what I know from my experience.
Of course. Thank you. Appreciate that disclaimer.
Thank you.
Awesome. All right. I'm going to stop the recording now.
Yeah.
This question comes from Sam. Is malaria medicine preventative, or is it just treatment? Do you know?
It's not treatment. Okay. It's definitely not treatment, because if it is treatment, then I think it would have already helped and saved a lot of people.
Okay, so it's not officially being used really yet by mainstream hospitals? It
is being used. We're using it. I have a friend actually who is a nurse practitioner. Her name is Julie Shea. She works at Mount Sinai Hospital, the main campus in New York City. So we've been talking, and she's been telling me about her experience, which has been, I think, the worst in our books as like nurses and NPs, where she says, you know, first of all, supplies are low, meaning that there's not enough feeding pumps, feeding like food for patients at all. They have to like rotate between patients to figure out who to feed. Two, there's not enough ventilators. Everybody who's been coming are needing to be intubated, which
Wow.
means that they're in severe respiratory distress.
Are they splitting ventilators at your hospital yet? Because I know Cuomo was talking about how they're splitting one ventilator and making two.
Yeah, not yet. And I did hear that too, but that's just scary.
Yeah.
Like one ventilator to one patient. That's always how it works. You know,
Right.
one machine breathing for one patient.
Yeah.
You know, I haven't gone back to work yet, and I really would like to have another interview after I go back to work to just really see it from my own eyes.
We'll do
But
round
these are
two. No problem. We'll do a round two.
but these are definitely the stories that my friend is telling me.
Yeah.
She's telling me that these patients are just really not doing well. And I've seen patients in ARDS, which is acute respiratory distress syndrome. And this is the syndrome that a lot of these patients are going into because their respiratory is in distress. What happens is that their lungs are filled with fluid and it starts inflaming. When that happens, your body also starts attacking itself. I think over time, fibroids also form, and this just really makes it hard for patients to breathe. Again, there's no treatment because I know you had mentioned about the malaria medication. Everybody in our hospital is pretty much on it, and she's even written it in her plan of care that this is what she's giving.
Right.
But even then, every single day, she is still seeing death, and she's still having to make phone calls to family members,
Right.
telling them that she's not even sure if doing CPR is a good option.
Wow.
Because their chances of living is not high.
Right.
One of the patients, she told me, that's unfortunately what they had to do. It's not just her, it's the whole team, I'm sure, that has to decide, passed away the next day.
Wow.
So there's a lot of sad stories.
I'm also reading about people that smoke, whether that's marijuana, cigarettes, or vaping.
Mm-hmm.
They've already compromised the integrity of their lungs.
Yeah.
And so when they get coronavirus, their body is already compromised to fighting it off.
Yes.
Do you think that there's some truth behind that?
Yeah, no, I already 100% agree with you that people who smoke are at a higher risk to getting it, and to get anything, actually, not just COVID, to getting pneumonia, to getting the flu, because what happens is, because you're smoking, it suppresses your immune function in the lung and it triggers inflammation. So you're already introducing toxins into your lung, basically, and when you get exposed to COVID, you have a lower immunity, and especially in older populations, they're not able to, for example, even like excrete or cough it out, or they're basically kind of inhale it in. It eventually gets into your lung, and it kind of just takes over.
Ugh, terrible. Well, I'm very thankful that I'm not a smoker. Obviously I've dabbled with these different things before, but I would not consider myself to be a smoker, which is good in this case, right?
Yeah, it's definitely a good idea to quit.
Also, yeah, I definitely agree. You guys hear that? Everyone listening, if you're smoking, you should probably quit for more reasons than coronavirus.
Or really just take it easy.
Yeah, or just smoke a lot less. So this question actually comes from Dear Asian Americans. The founder, Jerry Wan, asks, how has it been, what's HCW, healthcare worker? Okay. How has it been as an Asian American healthcare worker? And are you facing potential discrimination and any hate crimes? Are you experiencing this personally, or do you have any friends that have experienced it? Because your ethnicity is Chinese, right?
Yeah, I'm Chinese, 100%.
Okay, so have you experienced any hate crimes or racism towards you or any of your friends?
So this is definitely, a huge fear for the whole population and my whole race. Fortunately, I haven't faced it at work. I think as a healthcare profession, we're supposed to understand and be culturally competent to everyone, and that has been, especially in the professional area. However, I have experienced racism already, and I've actually never had really before.
So you're experiencing it now as of coronavirus?
I am experiencing now.
Wow. Not at work though, outside of work.
Outside of work.
Wow.
So,
do you have any experiences that you can think of?
Two huge examples or two huge times. So when I was still vacationing in Miami, beginning of this month, before our whole government was shut down, and we were already taking precautions. Like I brought Lysol with me, and we were cleaning everything, sanitizing everything. During that time when me and my girls were in Miami for just a girl trip, just walking down the strip, I had so much comments. Like people were just calling me coronavirus. Like
Wow.
there was not even like a, oh hey, it was just like coronavirus. And it was definitely targeted towards me because I mean, like I have like, in my group of friends, like it's just Caucasians and Asians. Um, and it wasn't just from one person, it was from multiple times. Um, what can I, like I couldn't say anything at the time, and I knew it was related to what's going on, obviously.
Yeah.
And the second time was recently, this week when I visited my family in Flushing. Now Flushing is full of Asians, and right now is really dead. So when I was walking out with my mom, there was this guy who is non-Asian. I'm not really sure if he was even drinking, but he was kind of just like walking around us and just cursing at us like fucking Chinese or like go back fucking home. It was just very, very hard to hear. And I was actually scared. I was like, you know what, let's just go home. Like we don't have to be out right now.
Right. Yeah, that's pretty that's terrifying. And I think that, my perspective, I'm a Mexican American, I'm brown, I've experienced racism, my whole life too. The way I look at it is I don't look at you, for example, as a Chinese person. I look at you as American first. And I think a lot of these people in this country are ignorant and stupid. And for some reason, they're just looking at your ethnicity, and that's what they're identifying you as. But that's not the way America works. We are a country of every single ethnicity in the world.
Yeah.
And if you were born here, if you have a U.S. passport, if you are a citizen of this country, you are American first, bottom line. So I just think that it's terrible that that's happened to you. And I hope that it goes away because it's awful. But thank you for answering that question.
Thank you. 100% agree.
How do you feel about Governor Cuomo? How do you feel that he's been doing?
I know he's working really hard and I know he's trying his best. I was actually talking to someone today. She's a nurse.
Yep.
I believe she works in Long Island, but she was telling me she feels that Governor Cuomo is kind of doing everything backwards. She mentioned that she feels I'm like, I agree. And I think there's just some things that he could have done too. But I asked her, like, what's your opinion? And she said, instead of spending so much money on people getting tested, he should be spending money on protecting everyone. For example, like maybe he could give everybody masks and everybody gloves for those people who have low income or just stuck at home and they're not able to go out. Like, where are they going to find masks and gloves?
Distribute.
In case. So she said, we're always thinking about like preventative measures, and that's one way to just protect yourself and prevent it. Because even if the test results, like what are you gonna do with that? Eventually, like he's working hard right now, and I do think I do feel like he is trying, like he's building hospitals. He's creating beds.
Right.
He's creating beds at the Jacob Javits Center and
4 different pop-up hospitals, basically.
Yeah, pop-up hospitals, and I know we have the National Guard helping to come too to open up beds for non-COVID patients. But it's not enough. Like New York it's being hit hard with thousands, tens of thousands of patients who are positive. It's just not enough help. It feels like.
Yeah. I hear that. I mean, the one thing that I definitely, are you hearing these beeps?
Yeah.
Oh my goodness. All right. Well, we'll have to leave those in. I don't know how to turn them off. The one thing I will say that I like about Governor Cuomo is I love his daily updates that he's doing in the news. So in my eyes, he's earned the nickname Daddy Cuomo. And I'd like to see Daddy Cuomo run for president in 2024. And I created his tagline. I wanted to say, Cuomo 2024, tagline, America's Daddy. That's what I'm going to vote.
Oh yeah, that's pretty awesome.
Pretty awesome, right? But no, that's definitely good feedback. And the other thing that I'll say, I also think that he needs to close the New York City parks. I know that he hasn't done that yet, and people are still playing basketball and other types of contact sports. So I do think that the one thing that I would give him as advice is close the parks, because I'm in Florida right now. I'm in the process of moving down to Miami, and Florida has closed every single park here. I cannot find a single park to park at my car, which I think is helpful. It's minimizing interaction.
That's really helpful.
So that's a good thing. Awesome. Is there anything else you want to add to my audience about coronavirus or anything like that? I mean, oh yeah, one thing I forgot to mention was, and we spoke a little bit about this on Instagram, I believe that living a healthy lifestyle is the number one way to prevent coronavirus. And when I say that, I mean exercising, eating right, drinking water, sleeping, a lot of sex. I had to throw that in there, obviously. Basically doing things to keep your immune system high. Would you agree that that's the first line of defense that all of us should be practicing?
I definitely agree. That is how you take care of yourself.
Right.
You know, even right now, the treatment for this COVID is a lot of fluids and rest, and you're just treating the symptoms. Really, that's what everybody is saying.
Right.
And I 100% agree, because to build your immunity, diet, exercise is always number one. And it's always something that, you know, your doctor will talk to you about, like, what's your diet like? Or, you know, how, like, are you exercising? Are you walking for at least 20 minutes?
Do you drink? Do you smoke?
Do you drink? Do you smoke? These are all the preliminary questions before we get into, you know, what are you here for today?
Right.
And these things are always things that people should keep in mind, because it's a lifestyle. You know, as you mentioned, that it shouldn't be 1 day or 2 days. It should be every single day, somehow included into the plan.
Yep.
I just want to bring up to say something that, you know, why this COVID, it's impacted me so much, not just as a healthcare worker, but, you know, in my personal life too, is because, like, my grandfather, like, do you mind if I talk about him for a minute?
Please.
You know, my grandfather lived long, 85 years, and my whole family are immigrants from China, and everybody came here. Well, my mom really decided to come here because she felt like she wanted to live the American dream. You know, so everybody else followed, which is just my grandparents, my grandpa, grandma, and her. And right now, that's just my family and my dad and me. So we have a family of 5. Grandpa was, you know what, the healthiest guy out of all of us, all 5 of us. He's the elderliest, but he was the healthiest, meaning that he was independent. He was still cooking for himself. For breakfast, he would have, like, black sesame. He would have eggs. He would have his vegetables. He would have, like, all these nutritious stuff, soybeans, soy milk, not even that much meat, you know? So he was, like, very, very healthy. And he was still cooking, and he was still walking himself to the bathroom, taking walks outside. Unfortunately, he did have a history of lung cancer. And that was found about, like, 5 years ago. And he never smoked in his life. Nobody in my family smokes or drinks. He never smoked. He was diagnosed with lung cancer. He fought it off. He stopped taking his medications. He was fine. But that was his history. He already had a lobectomy. So he would be in that population of the most vulnerable to this COVID. We did take our precautions. Like, I didn't even see him that much, you know, but I know my family knows enough to tell him to, you know, stay home or wash your hands or wear a mask. There are also just some people that are stubborn, that just won't listen to every single word you say. But he was healthy. When I saw him, I even, you know, protected him. Like, I wore my PPEs. And he just didn't look good. He really wasn't looking good. His breathing was very off, you know, and for a medical profession to say that, we needed something emergent to help him that I didn't have, although I had already tried at home. Now, he didn't want to go to the hospital, but it was just important for him to go because we didn't have what he needs. The hospital did. You know, and I trusted the system, and I trusted the healthcare workers to take care of him. When I got there, long story short, I had signed the DNR/DNI because that's what he wanted, and meaning do not do CPR and do not intubate. And I could not visit him. There was no visitors allowed, and I was only limited to one call per day. And that was through patient relations. And then I was able to, and then somebody called me back, like a nurse or a doctor had to call me back. It wasn't even like, oh, I can talk to them right now. I had to wait. So with that, it's just very hard to, get an update on what's going on at a time like this. And on the second day, we found out that he was positive. So there's just so much questions and fear and, plan, like what do we do now, in my head. And I had asked about what he was doing. I had asked about his vitals and his labs. And, lifestyle, like you mentioned, has a huge part, because they were telling me that his liver is fine and they were telling me that his kidney is fine. Unfortunately, his lung was the only part that was the problem, because he had history of lung cancer. Again, I have to emphasize, he was not a smoker. And at that moment, they told me he was fine. And then 10 minutes later, I got a phone call saying that he passed away. So it was very shocking, just because it was in 10 minutes and I have it on record. And I'm like, why is it that 1 minute he's okay and the next minute he's not? And they were saying, because it's COVID. As someone who works in the hospital or kind of knows this stuff, it was hard for me to believe. Like, how? Like this COVID, like we all really underestimated its abilities.
Wow.
So that is also why I haven't been at work for this week. So I'm not able to update you on like what I personally saw as a nurse in my unit or in a hospital, but that is what I personally went through this week.
Wow, so sorry for your loss. What I'd love to do is, if you have a picture of your grandfather, I'd love to put it here so people can actually, put a face to his name and his story, because he sounds like he lived an amazing life. I think we could all learn from your grandpa. Sesame seeds and vegetables and eggs for breakfast. He was mobile and cooking his own meals. I mean, that's more than a lot of younger people, do. So, I'm sorry that you lost your grandpa to this virus, and I know that definitely makes this a lot more personal for you, than other people. Thank you for sharing. I appreciate that. I think my audience appreciates that. Is there any closing notes that you want to share about the virus or anything else before we split?
Yeah, I feel like for America, it hasn't peaked yet. This is just the beginning, and this is beginning of this war against COVID. This is not like any other war. But this is a war towards mankind, where we're not able to see where our enemies are and where it's going to attack us from. And I hope that politicians are able to see what it is actually doing to everybody, and not just try to listen to the guidelines. We know what CDC is saying, we know what WHO is saying, but what is it really looking? What are the numbers looking like? Because that's what's real, and that's what's really impacting everybody. So I feel like everybody needs to take every precaution necessary, and not just say that, what, N95 is reusable, or, we don't need to wear even a hazard suit just because like this is enough to protect you. It might not, and I've already said some of my coworkers already gotten it. So it hasn't gotten there yet, but it's definitely scary already.
Damn. Well, obviously, thank you so much for the time and the stories and the insights. Obviously, we're going to have your Instagram name here on top, so if people want to, DM you or ask you questions, they could definitely do that. And
available for questions and answers.
Awesome. And once you get back to work, we will do a round 2. Yeah. We'll do a round 2 interview. So we'll put this as part 1.
Yeah, part 1. And
then we'll do a part 2.
Great.
All right.
Thank you so much for having me. I really appreciate it.
Do me a favor. Stay safe, stay healthy, and try not to get this virus, because I don't want to have anyone else I know to be infected by this thing.
Thanks. You too. You got to stay well in Florida.
Awesome.
Protect yourself, isolate yourself.
Cool. Thanks. All right, Emmy, thank you so much for the time, and have a great night, and we'll talk again soon.
Thanks a lot. Bye.
Okay. Bye.